Welcome everyone to another exciting lecture. Being humans, we may commit error unknowingly. Being professionals, we must keep it to the minimum with our knowledge and experience.
Medication errors, broadly defined as any error in the administration, prescription or dispensing of a drug. These can occur in any way along the route from the doctor who prescribes it to the ultimate deliverance to the patient. The fragmented nature of the healthcare system has resulted in the increase in various medical errors. Various medication errors can be plenty, which may include omission errors, wrong time errors, improper dosing errors, wrong dose errors, improper administration technique errors, wrong drug preparation errors, fragmented care errors, etc. Omission errors may typically happen wherein a nursing staff forgets to give a medication before the next scheduled dosage. This could result in ineffective or delayed response of the treatment. Wrong time error may happen when sometimes medication is given outside the predetermined interval from its scheduled time. Again, this might have its impact on the overall therapy. Improper dosing error may happen sometimes. A greater or lesser amount of a medication is delivered than is required to manage the patient's condition. Improper administration technique. Errors often includes administering a medication intravenously instead of orally. This error might have a greater impact over the effectiveness and efficacy of the drug activity. Wrong drug preparation errors is when the medication is incorrectly formulated, which is either too much or too little diluting solution is added when a medication is reconstituted. Fragmented care errors. So sometimes lack of communication exists between the prescribing physician and other healthcare professionals. Here is an example of illegible handwriting. Can you read this? Causes of medication errors may be plenty, which is distraction, environmental factors, lack of knowledge, understanding, incomplete patient information, memory lapses, systemic problems, etc. Let's see some example of distraction. E.g., a nurse who is distracted may read diazepam as diltiazem. This could happen because of unnecessary haste or carelessness. The resultant wrong drug administration could result in severe side effects. Environmental factors include poor lighting in the ward setting. Heat, cold, and other environmental factor can cause distraction in the work of the nursing staff. Overexhaustion due excessive working would enhance the chances of more medical errors by the staff. Lack of knowledge or understanding may include lack of appropriate knowledge regarding drug. Its effects and side effect would lead to wrong identification or non-identification of the symptoms that might arise. Memory lapses can be forgetting specifications regarding patient treatment and condition, would lead to a major event, e.g., forgetting to what the patient is allergic to. Systemic errors means medications that aren't properly labeled, medications with similar names placed in close proximity to one another, lack of barcode scanning system, and other issues can lead to medical errors. Preventing medication errors can be done, e.g., some steps should be taken care of in order to minimize various errors. You know the patient, know the drug, I keep lines of communication open. You double-check the high-alert medicines. Keep proper documentation. Participate actively in correcting issues identified. Keep the patient well-informed regarding the treatment. Ask for continuing education. Know the patient, have thorough information about patient, i.e. name, age, weight, vitals, allergies, diagnosis, lab reports, and the treatment being administered. Know the drug and keep yourself updated regarding accurate, current, and readily available drug information. Don't ignore any questions or concerns about a drug. Keep the lines of communication open is important, as communication is vitally important, as it is the root cause of many sentinel events, according to the Joint Commission, TJC. Miscommunication amongst the hospital staff, i.e. physician, nurses, pharmacist, and others, can lead to the medication errors. Practice a habit of electronic prescription. Double-check on high-alert medicine is encouraged. High-alert medicines can be proved to be devastating results if not administered with proper care. A tragic case involving the death of 3 infant patients after receiving massive heparin overdoses happened as a result of misleading packaging. Since this incident, the drug manufacturer now uses larger font sizes, tear-off cautionary labels, and different colors to distinguish drug doses. Medications often look alike and sound alike. This can be a source of errors. Double-check high-alert medications with another nurse to prevent accidental overdoses and other medication errors. Participate actively in correcting issues identified. If you see that look-alike or sound-alike medications are stored next to each other, ask your supervisor to correct the problem, emphasizing the increased risk of medication errors. Request that medications be properly labeled. Request that a bar coding system be implemented that allows for the verification of the 6 medication rights. Right individual, right medication, right dose, right time, right route, right documentation. Document each drug administered. Accurate documentation is essential and should include accurate recording of the drug information, the name of the drug, the dose, route, time, patient response, and any refusal of the drug by the patient. This would help alleviating the miscommunication error during shift changes too. Inform the patient about the drugs they are receiving. Make sure your patients know the names of the medications they are taking, what they look like, what they are for, how to take them, or how they will be administered, the dosage, and the potential side effects and interactions. Toward the end, do ask for continuing education. Ask for mandatory training sessions about medications that are introduced to your facility. Training should include medication-related policies, procedures, and protocols. Updates like these empower nurses and can help prevent medication errors. Nurse educators and continuing education providers should include all of these prevention tips and more in nurse education programs to help nurses avoid medication errors that could have detrimental or even deadly consequences for patients, and significant consequences for nurses, including disciplinary action, job dismissal, criminal charges, and mental anguish.